Hello everyone, today I will be talking about gingival inflammation index, also known as the GI index, and some baseline notes is that it does not consider pocket depth or bone loss. It is a reversible index, and GI mainly assesses the severity of gingivitis from the four surfaces of a tooth: facial, lingual, mesial, and distal, and this is based on the color, the consistency, and bleeding when probed. So for gingival inflammation index, you can evaluate one tooth or more, or actually the entire dentition. So the steps to do this are to look at the gingival margin when you insert the probe into the sulcus about 1 to 2 millimeters in. You will gently press against the gingiva in order to determine its firmness, and then you will move the probe circumferentially in a horizontal stroke in order to identify a score for each aspect. So for an individual tooth, you will give the tooth a score of 0 to 3 and divide that tooth score by 4. For multiple teeth, or for the entire dentition, you would total all the scores and divide by total number of teeth times 4 because of the number of surfaces. So here is the scoring criteria for each tooth. So you would give 0 points if the appearance is normal, there's no inflammation, no discoloration, and no bleeding. For a point of 1, there would be mild inflammation, slight arrhythmia, and minimal superficial alterations, as well as no bleeding. So a point of 0 and 1 both consist of no bleeding. For points of 2, there would be moderate inflammation, arrhythmia, and bleeding on probing. And for a point of 3, there would be severe inflammation, severe arrhythmia, and swelling. There would be a tendency to spontaneous bleeding and possible ulceration. So how do you interpret these scores after adding them all up? 0.1 to 1.0 would be equivalent to mild gingivitis. A score of 1.1 to 2.0 would be equivalent to moderate gingivitis, and then a score of 2.1 to 3.0 would be severe gingivitis. So let's take a look at an example. Say we are looking at tooth number 24, and we need the 4 surfaces of the tooth: the mesial, the distal, the lingual, and the facial. As you insert the probe, we notice that there is moderate inflammation and bleeding on the mesial surface. So that would be a score of 2. Then we take a look at the facial, and there is also moderate inflammation and bleeding on probing. So another score of 2. Then we take a look at the distal, and there's severe arrhythmia and swelling. So that would be a score of 3. Then we finish around to the lingual, and we see that it's normal gingiva, there's no inflammation, so that would be a score of 0. So if you're adding this individual tooth score all up, 3 plus 2 plus 2, plus 2 equals 7, okay? And then you would divide 7 by 4. So 7 divided by 4 is 1.75. So if you were to score this individual tooth, it would fall under moderate gingivitis. Again, we take a look at the interpretation. 1.75 falls under moderate gingivitis. Say you were doing the entire dentition, and all 32 teeth are present. So we'll just say all of this is 32 teeth, maxilla and mandibular. And the total score for all the surfaces equals to 200. You know that there are 32 teeth times 4, which is equal to 128. So 200 divided by 128 is equal to 1.56. 1.56 is also falling under moderate gingivitis. Okay, so that is how you would use the gingival indices of gingival inflammation. I hope that helps, and thank you.